This episode is proudly brought to you by the TPG Telecom Foundation, dedicated to creating opportunities to improve the health, well-being and education of Australian communities in need. Hi, I'm Megan Gilmour, MissingSchool co-founder and CEO, and this is Live&Learn. This is the podcast that unearths insights at the intersection of health and education, building a powerful alliance to keep kids with complex health conditions connected to school from anywhere. The podcast is recorded on Ngunnawal land, and we acknowledge and pay respect to the traditional owners of this land and the land on which you're listening. Melanie joins us in her capacity as the mother of a child with juvenile arthritis, sharing insights and perspectives based on her personal experiences in this role, rather than as a teacher. Welcome to our weekly webcast, a place to zero in on the interplay between health and education and to amplify the voices of those supporting school students to navigate their educational journey despite complex health challenges. And today we have with us Associate Professor Ruth Colagiuri AM. Ruth is a prominent health advocate and academic, recognised in Australia and internationally for her work in health policy and systemic approaches to chronic disease management. In 2019, motivated by her granddaughter's diagnosis of juvenile arthritis, Ruth co-founded Juvenile Arthritis Foundation Australia, JAFA, alongside her husband, Professor Stephen Colagiuri AO. JAFA is the primary organisation representing children with juvenile arthritis and their families in Australia. Alongside Ruth, we welcome her daughter Melanie, a school teacher, and granddaughter Chloe, who lives with arthritis and related issues. Welcome, Ruth, Melanie, and Chloe. We're so excited to have you on Live&Learn today.
Thank you very much, Megan. It's lovely to be here. Thank you for inviting us.
Thank you. It's a pleasure to be here.
So today we are here to talk about supporting school connections for students with complex medical and mental health conditions. Let's head into our first question. Tell us how juvenile arthritis impacts kids and why it's something every Australian needs to know and care about.
Okay, well, firstly, it's a hidden disability that affects many kids throughout Australia. It's much more common than people think. And its daily impact is varied depending on the type of arthritis people experience, their pain levels and which joints they have affected, which varies quite a bit. Most children suffer from chronic pain, which impacts their ability to participate in activities of daily living, school and sports and social activities. And further, many children experience mental health concerns, particularly anxiety as a result. Also, the other things that impact daily life are things like treatment, medication regimes, all the health professional appointments, the cost and time associated with referrals and appointments and prescriptions and all those kinds of things associated with that. And equally, in terms of school in particular, the time, liaising with schools and gaining the right support from school. I think in terms of daily activities, there's lots of little things that people don't really think about. So if I can give you a few of Chloe's experiences, when she was younger, she's got arthritis in her wrists, knees and ankles on both sides. When she was younger, she used to have lots of trouble turning on taps because her wrists were quite weak, opening the toothpaste, being able to wash her own hair, things like that. Now that she's older, she still does struggle with things like opening this, those soy sauce sushi things, cans of drink. She recently went to a school dance and everybody was provided a can of drink, and Chloe came home with hers full in her bag because she couldn't open it and she was too embarrassed to ask anybody else for help. With her knees and her ankles, she absolutely loves playing sport. She plays soccer, but does find that she gets quite a lot of pain as a result after she's finished, and will sometimes come home and not be able to make it up our stairs at home or have to kind of crawl or shuffle around the floor if it's been a particularly tough match. So I think those kinds of things people don't always think about. And I think also socially it impacts the things that you can and can't go and do with your friends. Now that she's a bit older, her friends go out by themselves and they go to the movies and then wander around the shops as young, almost teenagers typically do. And she finds that sometimes she can't keep up with everybody, but also doesn't want to make a big fuss about it. So just comes home in quite a lot of pain as a result.
Yeah, it's definitely something every Australian needs to know and care about. And I'm sure as we deepen into these questions and hear more from you, it'll become more evident just how much this means in a young person's life.
I actually wanted to add a little bit to that as well, Megan, on a sort of less personal, more global scale, and that is that we, JAFA commissioned research, which was published in November 2023, and the first study of the individual personal impact of juvenile arthritis in Australia. And the results showed that 85% of kids experience regular pain, and about 30–40% of that is severe pain. They miss quite a lot of school, which I know we'll go into later, so I won't talk too much about that at the moment. 46% reported the difficulties with activities of daily living, and that could be anything from, brushing your hair, or like Chloe getting tops off bottles, or using pencils and so forth, to being in wheelchairs and having braces and orthotics and so on and so forth. 77% said it impacted on sport, 68% said it impacted on leisure. There were, in terms of the appointments, going to appointments that Melanie's mentioned, these kids have 25, on average, 25 appointments with healthcare professionals each year, and that will be to about 5 different types of health professionals. And the very, very poor quality of life, which was much poorer than comparable diseases. And if Australians don't care about this disease that actually robs children of their childhood in a way, then they probably would care about the cost to government, because without taking account of the NDIS or any of those kinds of pensions or supports, the cost of healthcare, direct healthcare, to governments is over $24,000 per year per child, and that is considerably higher than comparable chronic diseases as well.
Mm-hmm.
So big impact.
Yeah. Thank you so much for giving those percentages there too. It's just puts everything into a really sharp context for us. And I guess many people probably assume things about juvenile arthritis. What's the $1 million question you get from parents or loved ones when their child experiences or is diagnosed with juvenile arthritis?
Yeah.
I'm not sure there's $1 million question, but I can tell you the things that we thought when Chloe was first diagnosed, and that was, how much pain will she be in? How will it affect her ability to participate in, school, sports, social activities, and activities of daily living? And the big question now is, will it continue into adulthood? And nobody actually knows what will happen. So that we've been told that once she turns 18, there's a chance it will resolve itself, and there's a chance that it won't, and there's no real evidence or research behind which will happen. So we just have to wait and see.
I think some of the things that, in addition to that, are raised on our private, we have a public and a private Facebook page for JAFA. The private Facebook page has about 1,000 people in it, 1,000 families, really, probably more people than families. And the things that are raised in that, as Melanie mentioned, and the side effects are a very strong one that come up, mental health issues and missing school, among difficulties accessing services as well, because the paediatric rheumatology workforce is very sparse on the ground.
Yeah, there's a lot going on there for young people, isn't there, and families alike. And as I said, we'll deepen into that for sure. And I just want to acknowledge to Chloe for joining us today to support us in talking about this, because it's so important that we hear from our young people and hear their experiences and know what they feel about this. I'm hearing that it affects so many areas of life, as well as causing pain, which is, when it's occurring, is all you can think about, really. And What's the most important thing that you want families to know as JAFA as an organisation, or Melanie or Chloe, when they're going through this experience?
I think Chloe actually had something that she'd like people to know, regardless of whether they're going through this experience, that she'd just like the general public to know first, and then I'll answer the next part.
Because it's invisible disease, people forget that I have arthritis, and they mainly can't see when I'm sore or when I'm not. And I want them to know that it is real, even if they can't see it.
Yeah, so important. So important.
And I think adding on to that really these children with juvenile arthritis are just amazing. They're such warriors. They experience more pain and discomfort than we really realise, and they push themselves on a daily basis, and they're so resilient, determined and inspirational, and that message is often seen on our Facebook page as well, and with families sharing stories about their children's achievements.
Yeah, indeed. And I guess we can say that collectively, can't we? But when we hear Chloe share walking through life and people not understanding what's going on for her, that must be challenging in many ways.
I think you find the hardest.
Yeah, I mean, I think that in terms of the juvenile arthritis community, I mean, we'd like people to know more, and we'd like there to be more people, a bigger workforce, particularly nurses, who are very thin on the ground and are probably the go-to people for a lot of in a lot of chronic disease areas as educators and, a resource for families managing. But I think one of the biggest problems for us is not so much I mean, that is a big problem, but a big problem for juvenile arthritis and for JAFA is the misconceptions about, that kids don't get arthritis and that sort of thing. So we would want the community to know, and health professionals actually, to know that kids do get arthritis. And if we can get that message across, we want them to know it's not the same as adult arthritis. I mean, I've got arthritis, but I'm an old woman and I've got knobbly fingers, sort of thing. I'm supposed to get arthritis, but children aren't supposed to get arthritis. And about, how painful it is. As Chloe said, it's invisible, and it's also highly unpredictable, which I think is one of the things that leads to people thinking the child might be putting it on, because one day they're okay and the next day they're not. So for people who don't understand, teachers, especially in high school, they've got different teachers, that's very difficult. So we'd just like people to understand the nature of the disease, I guess, and it's a very difficult concept to convey. And unpredictability is difficult to convey. So there's a lot of education needed all around for teachers and, general community and teachers, but particularly for teachers and health professionals, general health professionals.
And I guess the unpredictable aspect of it is something that really needs to be understood as well, because there'll be misconceptions around that. Well, you like this today, but not tomorrow, or any of those sorts of assumptions that get thrown into the mix. Knowing all that you know, what's your biggest hope for kids with juvenile arthritis and their families and loved ones when navigating juvenile arthritis?
Well, my biggest hope would be for a cure. Absolutely. And I'm sure you feel the same about a number of other childhood diseases. But a cure, in lieu of a cure, a means of prevention. And in lieu of that, just better ways, better treatments, better ways, more understanding community, and better ways of ensuring that these children can live their best possible lives. So, ways of managing, reducing pain and disability across the life course. Yes.
Melanie and Chloe, do you have anything to add to that biggest hope question?
What would you like? What do you always say that you would like when we have to go and see people? If you have to keep going to see people, how do you want it to work?
Oh, for one place to do all the appointments, so it was our school holidays.
Yes.
Chloe's greatest hope is to have one place to see everybody at the same time, so that we don't run around a lot, and also so that we can see all the right people. There are some people that we probably could benefit from seeing but don't get to see.
Yeah, I think that's a great ambition in the short term, isn't it?
I remember Chloe taking, I think she was going back the following week for an eye check, but I took her to see her paediatric rheumatologist because Melanie couldn't go. We waited for ages and ages and ages, and I can't remember how old Chloe was, maybe about 8 or so at the time. And it took the whole thing took about 5 hours or something. We don't live very far from the hospitals.
Yeah.
And Chloe was totally fed up with it and said that this was a terrible waste of perfectly good playtime. And I thought, well, that's a consumer perspective, and it should be fed back to the
absolutely.
To the it's just as important as any adult perspective. So, and it's very true, you know.
Yeah,
you have so much playtime, you don't waste it on appointments.
Exactly, and user experience is everything, isn't it? So, unless you're having lived in a hospital for, I don't know, 18 months straight, I could tell everybody in that hospital the way the hospital worked because I was using every single part of it, whereas any individual staff member, people who worked in it weren't even aware of. So I think this feedback loop into health systems is really critical for kids because, as you said, it's not just that the illness or disease isn't the same for adults and kids, but life isn't the same for adults and kids as well.
Exactly.
So
children aren't just little adults. A whole lot of things going on with their growth and development of their brains and bodies and their physiology and all sorts of different things. Yeah.
And so this question's a little bit back to front. It was meant to be earlier, but I'd love to know what brought you into the world of juvenile arthritis. You've told us through your bio, and we know because we're listening to these 3 generations. But I guess what I want to check on is, were you involved in, or any of you involved in juvenile arthritis? Was it in your family, or was there any background of it, or you were just sort of thrust into it?
No family background. And I have to say, having worked in health all my life, and Stephen, my partner in life and crime, and Chloe's granddad is a diabetes specialist, and so I mean, I'm sure knew far more about juvenile arthritis than I did. I knew it was painful, and I knew it wasn't a nice disease, but I don't think I realised quite how serious it was and quite how painful it was. Until Chloe was diagnosed and I started checking up about it. But the reason that we got in, I mean, Chloe and Melanie had no choice. Chloe was diagnosed and Melanie had no choice. I guess we did have a choice, but we expected the services for juvenile arthritis to be similar to the services for diabetes in children, because the prevalence is the same. And so, and that's the same as epilepsy and so forth. So there's common and serious chronic childhood diseases, and we expected there to be, plenty of paediatric rheumatologists and centres, like there are diabetes centres for children's hospitals, with dietitians and podiatrists and doctors and nurses and educators and dietitians and so on and so forth. And that's what we expected. And we were horrified when we saw that none of those things were there. And in fact, the total paediatric rheumatology, and I'm talking about the doctors only at this stage, were about 18 or 20 of them in the whole country. And that's compared with about, I don't know, 25 or 30 paediatric endocrinologists in New South Wales alone. So nobody knows how this came to be this way. Stephen and I were peripherally involved in the beginnings of the Juvenile Diabetes Research Foundation, which is a fantastic organisation, 40 years ago. And we looked at each other and said, well, this is like juvenile diabetes was 40 years ago. And it was, and it's moving. I mean, we're thankful that the federal government has been listening to our advocacy and, starting to fund some programs and research and so forth, but it's just been totally left behind by more than a generation. And I don't think politicians or health authorities do that on purpose. Nobody really wants children to suffer, but it just kind of fell into a hole in the ground. And so we're not digging because we're in a hole in the ground. We're digging to get it out of the hole in the ground. So that's become a sort of almost obsession, actually, to bring it up to an equitable level of resourcing and services to those diseases, so those kids have a chance at having as full and happy and healthy life as possible.
Yes, and we just want to acknowledge your work, all of you, because we're all in this together in a way. But,
Absolutely.
but you know, without your knowledge, your background knowledge as well, like your professional life prior to this, to be able to bring that perspective to it and say, you know, why when the prevalence rates are the same is this issue not getting any attention? And it also just shows the way, you know, large scale systemic problems work or don't work, is that even the people in the system can't do anything about it, or can't see it in the way that somebody coming in can. So
no, I think it's sort of just the myth that it's rare, and I'm sure this happens in other diseases as well, but it's a rare disease, and it's not, it's a very common disease. People are astounded on hearing it's the same prevalence as those other diseases I mentioned. And I don't really like to compare diseases, because I think those, you know, the children with those other diseases, other serious chronic childhood conditions, you know, they need as much help as they can get. And we're not saying anything that they shouldn't be having that. We're just saying that juvenile arthritis should also be having that level of investment and care, because we want our children to grow, and their children are our future. And so we want children to, you know, to be nurtured and grow and sort of meet their, you know, meet their full potential. And that's, you know, that's a sort of humanitarian thing, I suppose, in a way, but it's also,
and not to suffer.
It's also it's also an economic, in the economic interests of the country as well, to have a healthy workforce. So
yes, so thank you so much for the work that you do, and for bringing probably at a time in your life where you were looking at winding down.
Yes,
actually,
about that.
I just love it. It's such a powerful testament to not only, you know, love of a grandchild, but love of children more broadly, and also attaching in your capacity to helping so many other children, and Melanie acknowledging you as a mum in this as well.
Melanie does her bit helping with things, and so does Chloe. So we've got a fantastic community and a fantastic lot of advisors, pro bono advisors, and helpers. Actually, we're very lucky.
Absolutely.
Very fortunate. And friends like MissingSchool.
Yes, definitely friends. You mentioned some of the common or perhaps frustrating misconceptions. Are there any others you want to mention here? So
Always got one she'd like to add.
You said it.
No.
Sometimes people assume that I'm using my arthritis as an excuse to get out of doing things that I don't want to, rather than the fact that I'm actually sore
or in pain and can't do them.
Yeah. Chloe, that's really upsetting and frustrating just to hear that. And I do a lot of these calls, and I just want to let you know that happens to other kids too, in other situations, who have invisible illnesses as well. That is a very common thing that we hear. So you're not alone, but that doesn't make it any better.
And I think, in fact, in relation to schools, that's you know, it's a common issue in schools when you know, both from a teacher's perspective and from a parent's perspective, when you have casual teachers in particular that don't know the kids so well and think maybe they're just trying to get out of something. Or equally, Chloe's just started high school last year. In high school, when you have many different teachers who don't get to know you as well, that unfortunately becomes from time to time a common occurrence, because people, because of the fact that it's an invisible disease, people don't know how you feel or what level of pain you're experiencing, and also because it's unpredictable and you have flare-ups and you experience more pain on different days and can and can't do things. You know, one day you'll be able to do something and the next day you can't do the same thing, and people therefore assume that that's because you're not wanting to, not because you can't do it.
And how do you get around that, Chloe, if you want to answer that question?
Do you get around it?
No, I just deal with the pain.
She just currently deals with the pain and still does it. We're trying to work on that one.
yeah, that's I hope that's something that changes.
Yeah, let's hope so. And that's it. I just add to that we JAFA started doing kids roundtables, well, young people's roundtables, really, with the proper name. I just call them kids roundtables. And we had one child who was about maybe 13 or so. On the last one we did, which was an online one, we were talking about these really irritating things people do and say. And she said that somebody told her that, I don't know whether it was a teacher or just anyway, some adult told her she should just push through the pain.
Oh.
And she said, what they don't realise is just by the time I've got out of bed, I've already pushed through pain. I've been pushed through pain to just get out of bed, because it's worse for kids and most kids in the morning, especially when it's cold. But it does take quite a while to get going. And I think Chloe will vouch for the fact that she, in the wintertime particularly, sometimes has to have a hot bath or sit in front of a heater to kind of unravel. It's really difficult to get to school on time. So it's a pretty cruel, it's sort of, I don't know, insensitive thing to say to a child, really. But anyway, that's
yeah.
life.
And
that's
could that cause more, you know, by pushing through, can that cause more joint issues and things like that as well?
Well, I don't think it's advisable to push through. If the joint's inflamed, then it's you know, in danger. So I don't think that, you know, you're really meant to push through the pain in that regard. You're certainly meant to exercise as much as you can for whatever condition you're in. But
yeah. So in terms of misconceptions, we've got things that you've said there, which is the fact that people assume that children wouldn't have arthritis. That's a big one. And then that you might be making it up or making your pain up or whatever, because you're trying to get out of things. That's another big one there. And that obviously has a big impact on families as well as the children as well. So I imagine as a mum, trying to do those negotiations is not, it requires a large amount of diplomacy and everything else.
It does. It does. Yes, absolutely. And it's frustrating when you have a child that, you know, pushes through all the time. And like Mum was saying, is often quite sore, you know, particularly in winter when you've got there's a lot of stiffness and pain in the mornings when children wake up, and particularly in the winter, and when your arthritis is active or you've got a flare up. And like Mum was saying, once you've already pushed through all of that to get to school and get there and be off doing things, it's very frustrating to hear that people are sort of dismissing your child's feelings or what they're saying to them, particularly in the case of people like Chloe, who don't usually advocate for themselves because they don't want to be different and just want to go along with what they're meant to do. It's very frustrating that when she gets up the courage to do that, it gets dismissed. It doesn't always, but on the occasions that it does, it is a frustrating thing to happen.
Yeah. And I guess just practicing things over and over to say and to know how to respond. I think even it's really hard, Chloe, even for an adult in a work situation to navigate that, let alone in your circumstances. And it must be frustrating when you really want to do things and you're not able to do them, that you're having that added layer to that conversation. Ruth, how many Australian children and youth are living with juvenile arthritis right now?
Yeah, well, the estimate is from the Australian Institute of Health and Welfare is up to 30,000 naught to 24-year-olds. The diagnosis of juvenile arthritis is, within the diagnosis of juvenile arthritis is that it occurs in naught to 16-year-olds. And we think in that age group there are up to 10,000 children. So there's it's all secondary data, but JAFA with the Paediatric Rheumatology Group and another biobanking academic group has launched a juvenile arthritis registry. So we should be able to tell you more accurately in a few years. And that now has, after a year, has 500 registrants, I think. We're working on boosting that up. But it's quite a significant disease as childhood diseases go in terms of prevalence and incidence. But I mean, this is just another example of the lack of attention to it, in that there's been no registry, there's been no epidemiological studies on this. And so it's an estimate, as good an estimate as you can get. So we sort of say 6 to 10,000. I think it's more than more closer to 10,000.
Yeah. And that lack of data is also one of those problems that keeps the problem going, right? It's just trying to catch up with that.
That's right. Yeah. Trying to play catch up all the time.
Yeah. Is there a risk of delayed diagnosis, or in most cases of juvenile arthritis picked up easily?
The late diagnosis is a massive problem, and I'm really glad you asked me that, because Chloe was diagnosed quickly because her grandfather's a doctor and he didn't know that it was juvenile arthritis, but he knew enough to know who to refer her to check it out. And that happens sometimes. You hear people talking about their child was diagnosed quickly because there was a local GP and they'd recently done a course in, a short course in rheumatology, and they knew about this. But it is another example of it being left behind. It is very under-recognised by generalist health professionals, by primary care professionals, by GPs and pharmacists, and and I know they're not going to do medical treatment, but they're the ones they're on every street corner, and they're the ones people often go to for advice if the child has a sore knee or whatever. So our research on this shows that it's an average of 10 months to diagnosis, and a lot can happen in 10 months. That's from the time of symptoms till the child is actually diagnosed. That's corroborated by, there was a study 25 years ago, which I think said 11 months. And then the registry that I just mentioned is already showing 9.5 months. So it's all around that. We often say 10 months. So we were fortunate that the federal government has listened and taken some action on our advocacy about this, because the situation was such, and for some children, we say an average of 10 months, for some children, it can be 2 years or 3 years, and they can have permanent eye damage or permanent joint damage at the time of diagnosis. And that's what most of the complications are now, rather than something that inevitably happens. So we're fortunate that the federal government has listened to our advocacy on this, and we've been provided with funding in the last 2 federal budgets for a national program to support health professionals to recognise and diagnose juvenile arthritis early. And so that's being rolled out as we speak. It started in April, 1st of April this year, which is a funny day to start, actually, April Fool's Day, but we think that's a good omen.
Yeah.
And we'll continue until 2026. So that is already making a huge difference. And the increase in awareness, and as a result of other things that we've done as well, but the increase in awareness is actually palpable now. But it is still a massive problem, and the paediatric rheumatologists talk about children. Maybe a couple of times a year, they get somebody who's been it's not misdiagnosed, it's just undiagnosed.
Yeah. And
so our program will expand from focusing on primary care professionals like GPs and pharmacists and primary care nurses. In its second phase, it will expand to general paediatricians, to orthopaedic surgeons who often referred these kids and don't recognise it. Washout juvenile arthroscopy, painful, expensive tests, and so forth. And I think and sports doctors. I think part of the problem is the very small nature of the paediatric rheumatology workforce, which is fortunately also growing, but they don't have time to do anything but see the patients who are at their doorstep. So they don't have time for training GPs and going out proactively, raising awareness among the medical professional and doing seminars and various things that get done.
It's the clinical work takes up
just the clinical work. They're just staggering under the load of the clinical work.
Yeah.
But I think it is improving, and people, our JAFA community of parents and children, older children and young adults sort of tell us that, they heard this and they heard that we've done, or they heard somebody talking about juvenile arthritis and they heard it on the radio and so forth. And so that's absolutely fantastic, and that's exactly what we want. And politicians, we've really concentrated, we provide some services for families, for children and families, but our main thrust is on political advocacy, because it's the only way you're going to get the policy change and the resourcing and the funding for funding for research and so forth. And that's the only thing that's going to change everything. Yeah,
it's been a systematically and systemically invisible issue, and so that's the only way to get the change is through the systems. Yeah,
that's right.
Yeah. My next question is about complications, and I just want to preface it so that the question is, what kind of complications do kids with juvenile arthritis face? But I want to sort of throw my own observation in based on that delayed diagnosis and what Chloe said about the invisible nature of it, not being believed at times. Is one of the complications that these kids face mental health issues. We mentioned it earlier, and is if you're in pain and you're not getting a diagnosis and you're aching and you can't do things and this goes on, then I imagine that would take a huge toll mentally.
Yeah. So, I mean, the survey that I mentioned before that we did, there's 53% of the respondents mentioned mental health problem. But I think it's a lot more widespread than that in terms of how you define a mental health problem. So there's a lot of anxiety. And when you have, people with parents sort of quoting in the early stages, it's father telling me that, every week we drag our child out from under the bed screaming and to give her injection. And I never gave Chloe her injection once, and I was a nurse originally by trade before I went into public health and health education and so forth. And I worked in intensive care and outpatient departments, so I've given a lot of injections. I ended up in tears, but not a nice thing to have to do to your child. It's an awful thing for a child to have to put up with. So, and then you take that, the being different, the being excited about your friend's birthday party, and getting up on that morning and being too sick and sore to go to the party, or struggling to go to the party and then having to sit in the corner because you can't join in the games, being socially marginalised at school and in the playground and at sport. You'd be mad if you didn't have if you didn't have a mental health problem from that. There'd be something wrong with you. Really, I think so. You can't expect people to be normal about it. Invasive procedures, blood taking, all that stuff.
Yeah, there's a lot, and family stress as well thrown in.
Absolutely. The impact on families.
Yeah, and also you mentioned as complications that joint damage and eye damage are the main complications, especially from a delayed diagnosis, and that's going to just compound everything.
Yeah, and I mean there are a number of different it's quite a complex disease. There are a number of different subtypes of juvenile arthritis. So it can affect the joints, which is the most commonly thought about one. And in addition, it can affect the eyes, and it can cause blindness if that's not treated. And I'd preface this with saying that, I mean, Chloe has the eye checks and she's fine. It hasn't affected her eyes, but they all have regular eye checks all the time. So joints and eyes, and some types of juvenile arthritis, it affects the skin. So there's a psoriatic psoriasis of the skin, can affect the internal organs. Kids get rashes and temperatures, and it's quite an unpleasant sort of form of it. So there are a whole range of complications that can affect one joint or many joints. It can affect jaws and shoulders, and so there's a range of different complications, as Melanie said earlier, depending on which joints and how many joints, and then what else may be involved. But having said that, we have reached a stage where in the last 15 to 20 years, the introduction of these medications called biologic medications that work in slightly different ways, but they all kind of modulate the immune response, which is the problem, and attacks the joints and eyes and whatever else. And so before that, a diagnosis of juvenile arthritis was really a sentence to disability, to life with disability. And that's no longer true. We can get kids diagnosed early and onto effective treatments early. That is already these biologics have already revolutionised the outcomes of juvenile arthritis.
Mm.
We just have to be sure we get them diagnosed and get them onto the right treatment, and also having those non-medical treatments like physiotherapy and occupational therapy. And Chloe mentioned her hands before, so so she's got about half the strength in her hands. She might have been going to mention that now. Actually, I might be encroaching on Chloe's response to this. I think Chloe or Melanie might have something to say about this from a personal perspective as well.
I think also not about complications, but about side effects from medications are what we've experienced more. Chloe is having the eye checks and is lucky not to have any problems in that area, but she has experienced side effects from all the medications that she's taken, and her first lot of medication caused, nausea, loss of appetite, mouth ulcers, which was quite unpleasant. And so they changed her to injections, which, as Mum was saying, nobody liked those, did they? Chloe once counted how many injections she had. How many was it a year? Do you remember?
It was 140.
Yeah. And they were not pleasant, and there was a lot of distress in our household around having those twice weekly injections plus the blood test. Current medication is an oral tablet, which she's much happier with, but it does have the side effect of light sensitivity. So she gets much more sunburnt, which in summer is quite a tricky thing to manage, given that she's already fair-skinned.
Yes.
So they're not insurmountable things, but there are things that we have to consider as a result of the treatment that she's having.
Yeah, and there are also things that are important for schools to know too, and understand that the side effects of medication are a real aspect of your educational journey.
Yeah, absolutely.
Whether that causes drowsiness or low energy, or sometimes even dealing with a serious condition is energy draining. It's just on its own, just managing through the day. So and I just want to swing back around again to the work that JAFA is doing to make sure that we know who needs help. We're finding out as soon as possible that the best medications are available, that there's enough people to clinically manage and get those kids diagnosed early and on best treatments, because not only the side effects, but just what can happen, as you said, Ruth, a life of disability, and that it doesn't have to be that way.
No,
that's the main point we want to make here, right? Is doesn't have to be that way. So
it's not inevitable. No way to get people willing to get them diagnosed. That's not inevitable, not even likely anymore. Yeah.
Siblings and peers of kids with juvenile arthritis, how are they impacted, and what should families be across, or is there any tips we want to give here about siblings and peers?
Absolutely. Siblings are definitely impacted because so when Chloe was diagnosed, she was 6, so she's the youngest in our family, so her siblings were roughly almost 10 and almost 12. So they were old enough to understand, but there was definitely still a period where they felt a bit sort of neglected and a bit left out because of all the appointments and all the treatment and all the focus on Chloe, and they felt like she was being treated a bit differently. And there were times where she didn't have to do certain jobs or chores around the house when she was in pain, or when we were trying to get her arthritis under control, which her brother in particular didn't always understand. He was the closest in age to her. Now that everyone's older, that's not an issue and they're incredibly supportive, but I can imagine with younger children that would be a more significant problem. Equally, I think what people don't think about is the types of activities that we can do as a family are often impacted. So, we used to do bushwalks and bike riding as families and things like that, and certainly when Chloe was first diagnosed and when her arthritis is active or she's having a flare-up, those things are not possible. Even holidays such as, going to the snow and going skiing is more complicated and trickier. And even just days out where you go to the Easter show or a full day out somewhere, there's just more things that you need to consider and think about in terms of how you'll get there and where you park and how much walking's involved, and simple things that I don't think people would otherwise think about. So I suppose if I was giving advice, it would just be to be honest and open with your other children and have age-appropriate conversations with them about it so that they can understand it. And we tried very hard to actively do other things with our other children and make them feel special, and to avoid any resentment in the family about that.
Yeah. Did the siblings feel any anxiety about Chloe's situation?
My eldest daughter did, yes. Yeah. she's a bit of a worrier anyway, but yes, definitely.
Yeah. So and then that's the point too, isn't it? That the siblings and then peers, will come to that when we get to school now in the next section, but is that it's everyone's journey in a way, and everybody's impacted, which I guess, Ruth, when we're talking about the impacts, we're not even really fully measuring that, are we? Including effects on siblings and the way siblings navigate these journeys. So all the more reason why it's important to do the work that JAFA is doing, to do all the good things that we've talked about. School. So, Ruth, what's the current population of school-aged children with juvenile arthritis? And is it tracked?
It's just an estimate based on the fact that there's, you would know much better than I do, I think there's something like 4 million and something school-aged children in Australia at any given moment. And so based on that, it's probably about 5,000 or 6,000 school children. But this again is just, it's something that, ultimately the registry will be able to answer those sorts of questions. And hopefully, as you know, that I'm forever looking for funding for a school survey. So.
Yes, we are, Ruth.
Like you. So that will all be revealed.
Yes.
So there's no such luck that we have anything to track it, so forth. Although we do have JAFA is involved with a national data linkage project. It's a MRFF, Medical Research Futures Fund. Grant that's operating from Sydney University, and it's just amazing. It's just amazing. They can link anything with anything. So they can link knee aspirations, which is one of the things we haven't mentioned, that children have joint injections, either fluid taking off their joints or steroids, corticosteroids injected into them to reduce the inflammation for certain reasons. And so it can tell you what the children with, it's already identified, of course, but what a child with who's had 3 knee aspirations, what that child's lap plan is. So it can link anything with anything. It's just amazing. It's just fantastic. So that will be shedding some light on, do kids who have more of this surgery, I'm just using this one example because it happened to pop into my head, but there are all sorts of other things. How does that impact on their school attendance? Specific reasons.
Well, there's some research out of Australia from a few years ago. It was released, showing that children who are hospitalised with a chronic condition 3 times more likely to fall behind at school, and that's based on NAPLAN data and how they perform against the national standard or baseline standard. So yes,
well,
I mean,
all of that makes intuitive sense, but it would be great to have the data to back it up.
Absolutely. This is what we need. And there's, in Australia, there's no way of knowing right now how many children miss school due to a chronic condition and how much school they miss. And what the intersections are between different, whether there's a physical disability present as well as, I mean, a visible physical disability. There's all sorts, it's a Venn diagram, and we don't have the data on any of that. So,
so I might be venturing into something that you were maybe about to ask, but we do know from our, again, the same survey that I mentioned before, that kids with juvenile arthritis miss 12% of school on average. But the question and I know you might say, and Melanie might say, that all kids miss 10%. But the question was actually how much school does your child miss because of their juvenile arthritis? And we don't really know how the parents were obviously answering that for younger children. We don't really know how they interpreted that question, but we do find that parents, and one of our board members actually was talking about her child having mouth ulcers, which is a common and not very pleasant side effect that Chloe used to get on this same particular medication, which she's no longer taking, and that how they sent her to school anyway because she misses because she misses school because of her juvenile arthritis. So I think often people will send their kids to school, the child with juvenile arthritis to school on a day that if the child didn't have juvenile arthritis, they might have just let them stay home and rest up a bit. But they're fearful about the amount of school they miss for appointments and for other things, or when they're sick, that when it's not a direct juvenile arthritis thing, they send them off to take them off to school. I don't know whether that's your experience, Melanie, or...
Yeah, well, I think Chloe was going to say something about that first, and then I can add something.
I miss some school when I'm super sore, and last year was my first year of high school, so it was much harder, and I was much more sore because of all the changing classes, and particularly the stairs at my school.
Very hilly school, isn't it, your school?
I love stairs.
And I think, I was looking up actually Chloe's attendance last year, and her arthritis is quite well controlled at the moment, but she still did miss 15 days of school, not including days for appointments, simply due to waking up some mornings and just not being able to get up and get there.
Yeah. Did you say the 15 days included appointments?
No, it
No,
didn't.
no. Yeah. So, yes, I mean, 20 days is the threshold in the research. But obviously, and, you know, there's a great researcher in Australia who has done a lot of studies on school attendance, and I think it's her point of view that it's a rule of thumb that missing more than 20 doesn't mean you're necessarily, there's a whole lot of contextual things there in terms of how a child does at school. And
but I think it's like it's hard to catch up sometimes, and I've heard people say that with high school children in particular, because as Melanie said before, they've got a different teacher. So the teacher, all different teachers for different subjects. So the teacher doesn't necessarily know how much they've missed or what they've missed in other classes. And I've heard people say that the child's gone back to school after missing a few days and said, that asked the teacher about helping them catch up or something. And the teacher might say, and I'm sure a lot of teachers don't do this, but some teachers would just say, oh, we did from page 125 to 132 in the textbook, just check it out.
Yeah.
So it's not really very helpful.
Because now you can teach yourself.
Yeah, go teach yourself.
This is one of my bugbears, is just sending worksheets home to kids who are with chronic conditions, missing school, because
I mean, but it's an insoluble problem, and I hope it's not an insoluble problem. But on the other hand, I mean, poor teachers are expected to do an awful lot. And certainly in terms of the multiplicity of health conditions children can have and the mental health problems that abound. So it's very difficult for them, I guess, to keep up with all this as well. Yes.
I mean, I'm interested in your point of view on this too, is at a time and place where the actual condition doesn't need to be mentioned, but there's a way to document symptoms and design adjustments based on what the child or the student needs without having to deeply disclose their medical situation, but more symptomology and things like that, where there's, a more nationally consistent approach, as we talk about a lot, Ruth, that in schools, and where teachers are supported to do this without having to be doctors, without having to be nurses. I think that's the place that we need to get to, is where, adjustments match symptoms and things like, so we're not necessarily expecting the teacher to have this deep knowledge of the condition, because they won't. But it's more how do we translate that student's needs, help the teacher translate that student needs into well-being outcomes, from anything from academically through just socially, emotionally, or any other well-being measures.
And look, I'm sure it varies with different diseases, because for our kids, well, I shouldn't say our kids, but children with juvenile arthritis, they're not necessarily missing big blocks of school. It might be a couple of days a week, which is still significant, and it's a cumulative thing, obviously, but it's probably not as hard to go back to school as it would be for a child who misses a month or 2 months or 6 months. So it must be horrendously difficult for them to actually go back to school after they've missed that much school.
Yeah. And I think there's the other thing which we at Missing School do talk about, but not as often as we do about missed school, because it's a harder argument to sort of mount and not as easily measured, I suppose. But it's some of the things that Chloe has shared there. There's not only, it sounds to me like there's not only the the variables that can occur in any one individual, but then you've got environmental variables like stairs or hills or other things like that. And so then we're throwing all those things into the mix. And if you're in pain or you're not diagnosed or it's not well managed, then you may be at school, but how much, of your schooling are you able to fully participate in a holistic way, given what these kids are coping with? So I think that's also an important point to make as well, and just keeps bringing us back to the same point, which is why Australians need to know and care about this, and why we need to get all of these important things through that JAFA is working on. Critical school, are there critical times in a child's school life with juvenile arthritis and things families and schools should be prepared for? I'm thinking of transitions or start of school. Are there anything's there that stand out for you?
Mainly assessments, because all the assessments usually on paper, so they're handwritten and you can't type them. With my arthritis in my wrists, it means I have half the normal strength as other kids my age, which makes writing for a long time harder. Also, I get sore, and it also makes my writing really messy and hard for the marker to read, especially sometimes the marker isn't always your class teacher, so they don't always know about it.
Yeah, so that's a super important one.
Yeah, absolutely. And I think definitely transitions when you're transitioning to high school and when you're first starting school. I'm not sure that there are other particular times other than probably the HSC in terms of, needing adjustments and support on top of normal assessments. And, whilst you can get adjustments through NESA, it's often, in New South Wales at least, it's often a bit of a complicated process and requires some repeated advocacy to get them through. And there are many families that have said to us they've had them knocked back and had trouble and had to keep kind of trying. I think also, Chloe currently has a scribe for assessments now that her school has put in place. And, when she goes through the HSC in, 2029, hopefully it will be electronic by then, but if it's still on paper, she will require a scribe because she will not be able to write for that long. But you don't really like that process, do you? What don't you like about it? What's hard about it?
Because I usually think while I write and think about what I'm going to write next, and I know what I'm talking about, but it's hard to say it to the writer. Plus you have to think about editing if you want to swap out words.
Yeah.
So it actually, I think in some ways, I appreciate the school's trying to do it to be helpful, but in some ways I think it disadvantages children because it's a different way of doing it and it's a much slower process and it changes your thought process.
Yeah, it's not your process.
Yeah. And I think also sometimes children are concerned about the person doing it with them and whether they're going to look silly or what they're going to say is silly or whether the person thinks, they don't know what they're talking about. It's just, it adds another layer to it that I think other children don't have to deal with.
Yeah, and these are the big things that are the little things. Like, do you know what I mean? It's like I hear that, and I just, even after all of our conversation, I wouldn't know that unless I heard it from Chloe. Like, I wouldn't, put those things together. So I think this is why our students' voice in this is just going to be more and more important. And Chloe, do you have any ideas? Like, what would be your ideal with that? What would
probably to just be able to type, because I would only be able to type just as fast as another student without juvenile arthritis would be able to write.
That is exactly what the OTs say. I've got one OT in, I'm sure there's more than one, but one OT in Sydney and another one in Western Australia who are really are on a mission to try and do something about this. And they say exactly that these children who have problems with their fingers or hands or wrists,
Yeah.
It is thought that if they're allowed to use computers, it will advantage them compared with the other children who have to write because it will be faster, and that it's almost the opposite, that these kids can rarely type as fast as a child without any problem with their hands or wrists or fingers can write.
Yeah.
So
I think it's a classic example, though, where you give that information, Ruth, about OTs, where because again, even just on this is the 20th such call I've done. This sort of thing, I hear this every time, and we're talking about a lot of kids. So I sort of, we need to get to a point, don't we, where evidence-based approaches are being applied. And if this, then that, here's the options, and it's just easy for teachers to see and know. Those sorts of things are pre-approved by NESA, not on individual child basis, but as a part of, a child who has a specific diagnosis. It's not, individuals shouldn't need to be fighting this out.
Well, exactly. And the other
hard.
thing about it is the variations between the different states and territories. So I'm not sure if this is really true or not. I understand, and I think it is true, that in Victoria for the final high school exam, that students can use a computer. In New South Wales, you can't. It's totally ridiculous. I mean, we're right next door to each other. It's bizarre.
Yeah.
So it should be uniform across the country.
Yeah, it should be, especially since we've got a nationally based accreditation system. So if those are sort of, this is what we're working for. This is the kind of thing that MissingSchool is really working for, and we're going to drive further and further into this because it doesn't need to be this hard.
That's right. That's right.
And I think circling back to your point about a consistent approach, I think the issue is also that sometimes the supports that children receive in school, NESA will then not allow in the HSC. So children have spent all of their high schooling being used to these certain supports and adjustments for exams, and then suddenly they're taken away at the last minute because NESA declines those, because everybody has to put in an individual application to receive them. Right. Yeah, I think this sits, Ruth, Melanie and Chloe, I think this sits right in the centre of a big system problem where it's like somebody's got to go and argue these things out in the way that JAFA's arguing out diagnosis times and having a registry and those sorts of things. It's one of those ones that unless individuals can't change it, do you know what I mean? It's just that's the problem, because that just seems ludicrous, doesn't it? You've been given that adjustment and then you get to the HSC and you can't have it. It does not even make sense.
I mean, I think the other issue with it that follows on from that is that even individual organisations can't fix it, because for us to go along, for JAFA to go along to, let's say the Federal Education Minister and say, we want you to do something about this nationally, or the policy people for the nation and so forth, can you do something about this? He would probably say, well, how many children are we talking about?
Well, the first thing he'd say is that's a state and territory issue.
2,000 out of all the kids who are doing their HSC, so we need to actually get together with you. I mean, it's great for MissingSchool to use to lead something like this, but the rest of us who have a stake in this need to get together with you and support you to back you up to do it, I think.
Yes, and it's so important to have these conversations, because a lot of these idiosyncrasies about the system don't come out unless they're these one-on-one conversations. It's like individuals are experiencing them, but they're not seen systemically. So But also what you get at a federal level is, you know, it'll be that's something to discuss with states and territories, which of course is also quite challenging. But there are ways through that. The disability standards for education as a national regulation is really the thing that you know, ultimately going to help with this. So we're getting towards the end now. Chloe, did you have anything else you wanted to say on that? No. Thank you so much for what you shared so far, by the way. It's so helpful for us to understand these big things that other people just would not be able to see unless you shared them with us. So as we kind of come to the end now, we've talked about a lot, and I just want to pick up on anything that we might not have covered. So have we covered biggest challenges or vulnerabilities facing kids with juvenile arthritis at school? We've talked about pain. We've talked about needing to have their meds and how those might be having side effects. We've talked about not being able to participate in some activities, and we've talked about having the issue not seen, which creates a vulnerability on its own. Are there other things we need to pick up?
I would just, add that I think despite whatever support schools have in place, and that does vary from school to school and is sometimes great and sometimes not great, Chloe's current school has been fantastic and have, you know, followed the advice from the OT and have made significant changes and liaised with her and I and consulted with us to create personal learning plans and to get her opinion about how things work and don't work, and have even gone to the trouble of physically moving the location of her homeroom so that it's close to a lift. So they've been incredibly supportive. And they're a great example of a school that's doing all the right things. Despite that, I think the individual teachers make a huge difference, and teacher awareness and teacher knowledge makes a huge difference. And despite all of those things for this year, Chloe did have a teacher who clearly hadn't read her learning plan and had no idea and disadvantaged her in an assessment due to her handwriting, but more importantly, discouraged Chloe's self-advocacy and her belief in herself and her confidence around this. It was very easily resolved once we raised it again, but it was disappointing that with all that the school that had done, that it wasn't kind of being looked at or considered. And I think that she'd had in primary school as well, when she was first diagnosed, an unfortunate experience of a teacher who really had no knowledge about arthritis, which is totally fine, but equally had no interest in learning anything more about it. And Chloe really did, as a result, was not able to access some of her pain management strategies, was not able to get any adjustments in the classroom without us having to come in on top of it and sort of have an argument about it, which then resulted in her not wanting to go to school and refusing to go to school. She'd been a child who had absolutely loved school up until then. And still to this day, I think this is the reason that she doesn't want to be different and she doesn't want to say anything to anybody. So she will still not really speak up with her teachers. Her teachers are working on non-verbal ways that she can do that, where she doesn't have to do it in front of the class, which you really like those ways, don't you? Chloe's got great ideas that she's thought of, that she's shared with her teachers, and they're all on board. But it is unfortunate that sort of 5 or 6 years after having this teacher, she's still needing to work on her self-advocacy skills around this as a result of the way he managed it.
Yeah. You said the way he managed it. Do you think there's a gender difference?
No, I don't think so. I think it was just one of those things. And I think, look, most teachers I think are amazing. So I think it's genuinely just one of those things. But I do think that individual teachers have a massive impact.
Yes.
Regardless of school systems, whether they're good systems or bad systems, the individual teachers make a huge impact.
Yeah, I definitely agree with you on that. And as a mother with a lived experience, my son had a bone marrow transplant, and so I that's why Missing School exists now
Yeah.
through my own journey. And I noticed, like you mentioned, some of the things there. We also notice as an organisation, if there's a relief teacher, sometimes things fall over a little bit, and we understand that. It's kind of harder to comprehend when it is a teacher you've been working with for a long time.
Yes.
But I think, you know, I guess that is inevitable that humans are going to be different. And Chloe, that's where all your amazing practice is going to come in. And you probably have moved so much further ahead in your own self-advocacy than you realize from beginning to now. And I imagine that that's going to continue. And I'd like to think that your peers will be able to observe that in a positive way too. Sometimes we don't want to stand out. And I hear that from lots of kids we deal with here at Missing School. Kids just want to be normal and, you know, get to be at school and don't necessarily want to be singled out for special treatment. Sometimes whether that's positive or negative. But just this is me just giving you the most encouragement I can give you to, there's nothing like self-agency to change your life, not just your condition, but to actually get what you want out of life. So I always, you know, this is my plug to everyone who'll listen. Use your self-agency and grow your self-agency, meaning that you can navigate things as using your own gifts and talents, because the world needs more people like you. And we really want to celebrate every part of you. We've talked a lot today about your condition, but of course you're so much more than that. There's so much more to who you are than that. And I just want to acknowledge that as well, because we have focused on that. But I hope to hear more from Ruth about how you're going and all the other things that you're doing in your life, as Ruth and I have lots of chats. So
and you might think Chloe is very, very quiet, but she actually won the debating award for her year last year.
I love it.
So there you go.
And I reckon it's because
because she's had to stand up for herself for a
yeah,
well.
yeah, I reckon it's because of all of those skills that you're developing that, you know, sometimes the ones that feel the hardest, Chloe, are the ones that teach us the most. We don't get to choose every situation we're in, but we sure can do something with it. That's for sure.
We've got much better this year, haven't you? Yeah.
Yeah. And thank you, Melanie, for sharing your perspectives right at the intersection of being a teacher and a mum in that lived experience, because in the one hand you'll have your teacher's hat on the other hand, you are mum, and that's the most important role you play to your children. I remember me trying to teach Darcy at home when he was sick. And we both hated it, and he cried. And I just can tell you for sure that I make a terrible teacher. So it's
harder to teach your own children.
I just have so much respect for teachers and the work that you do. And, you know, it's really one of the most important jobs.
Yes, absolutely.
Anywhere in the world.
What could be more important? Well, first of all, being a parent, I guess, and second, being a teacher.
Yeah. No, it is. And I just hope that, you know, because I also want to acknowledge that there's a lot going on out there at the moment, isn't there, with lots of kids having different health crises and different experiences. And teachers, of course, it's a hand in glove thing.
Different behavioural crises, I think, in some cases as well.
That's right. That's right. So just as we go to close, is there anything else we should be asking about school quality of life for kids with juvenile arthritis?
I guess from JAFA's point of view, as an organisation, I think we've covered at least you know, at least superficially, probably everything. And, you know, with children with other diseases, I think it's even more so than juvenile arthritis, for what I'm going to say now, because of as I mentioned, that kids with juvenile arthritis don't often have long periods of time off, but that going back to school after you've had some time off, I think is critical. And you must hear that from everybody in your own experience with your son. Must have been horrendous when he was off school for a long time. So I think that's really critical. And I think just getting the evidence, you know, just being able to get the evidence that actually helps to unravel and undo and get rid of the, you know, what I see as both unconscious and active discrimination that does go on in schools. And not I'm not so much talking only about teachers, but about the state-based education organisations, authorities, and so forth. I think some of it is, I think, a bit harsh actually in terms of not allowing accommodations that should be allowed. And I'm aware that they're inundated with people who don't need accommodations, who are actually trying to get them, but you know, there should be a better way of doing this, as we said before.
Yes, and hopefully we are moving things along in this respect. And, you know, the global and national school attendance crisis is really shining a light on the way school models work and don't work for people, and also with a lot of teachers leaving the profession as well. We know that a lot of it has to do with the way schools operate, and schools, as you say, are beholden to the education systems that run them. So there's much work to do, but I think there is progress, and we're at a point in time where we can together get that, push that along further.
And you're doing an absolutely, I mean, MissingSchool is doing an absolutely amazing job on this. You've done such wonderful, innovative and clever things, and I just really wish you well with that, because you've already made a huge difference, and you're continuing to make a huge difference in bringing this to light and actually providing solutions. So it's not just enough to talk about the problem, and you're not just talking about the problem, you're actually providing solutions, which is fantastic. Really admire.
I want Australia to be best in the world at this, and I believe we can be. It was in the early 1950s when a woman noticed that kids in rural areas were, while they had correspondence schools, there was this social isolation and the disruption to their social connections to do with schooling that were the issue, and that's how School of the Air started back then. And so I think we've had a history of being able to provide learning from anywhere, and that's what I hope for children who are missing school, that they can just go in and out of school and continue their school education, whether they're in hospital, recuperating at home or at school, and that teachers are supported to do that, that it's not left up to teachers, that our education department set that up so that teachers can just teach once. And so I was told this time last year that would be too ambitious to think about. And I say, well, schools did it faster than any other industry, changed their model overnight during COVID. And it's not a great example, because everyone says, oh, no, COVID, that was terrible. But it was a pandemic. So we shouldn't just attribute, you know, the challenges with learning from home. We shouldn't just look at the pandemic era and say that's all there was. There's because MissingSchool's data shows so much evidence that once teachers are equipped and children and families are willing, that learn from anywhere can happen, and it can be easy. It doesn't always work, but it's better than going without school when you're not there.
Absolutely, anything's better than that.
Yeah. So this is the last thing. What's your call to action for juvenile arthritis in 7 words or less?
Mine is to reduce pain and disability and optimise children's potential over the life course.
Yeah, Amazing. Melanie and Chloe, do you?
What's ours, Chloe? To acknowledge the invisible.
Yeah. Yeah. Yes, that's been a big theme, hasn't it? Yeah. And we talk about, say, 5,000 kids here, and we think there's more. But when we add together all of the different conditions,
absolutely, it's huge.
There are so many kids in school, and Chloe, you probably won't know. Some of your peers are going through things, and you won't know that those things either. So I only say that to say you're not alone. And again, it might not help with the particular challenges that you have personally, but to think that there are a lot of other kids out there who have health conditions and can live a strong, good life and reach their dreams and potential is the goal. So a big shout out to Ruth, Melanie and Chloe. Thank you so much for having this conversation with me today. I feel, as I said, privileged to sit with 3 generations of amazing women and to be able to learn and benefit from what you know and the work that you're doing and the way that you live, and what it means for young people in Australia. I'd like to let everyone know to head on over to JAFA, jafa.org.au, and give generously and provide shout outs among all your friends and family so that we can get more kids who have juvenile arthritis support and to live their strongest life and their best life. Thank you for joining me today, Ruth, Melanie and Chloe.
Thank you so much for having us. It was a privilege talking to you.
Thank you.
Thank you very much for having us both.
Our pleasure. Thanks everyone for tuning in. Help us turn up the volume so all kids are seen and heard. Follow along, like, share, comment, or leave us a review because we love hearing from you. And if you want to donate, head to MissingSchool.org.au because every dollar makes a difference.